My name is Toni Morris, and I'm the CEO here at Sutter Surgical Hospital, North Valley. People often ask me what it is about our hospital that makes us special. My belief about it is that we are a new facility, so we had the opportunity to create a culture. And this culture is something that you don't just have automatically, you work at it. But we've created a culture where everyone has a part, has a responsibility, and cares about the work that they do here. We often refer to the care that we provide here at Sutter Surgical Hospital as personalized hospital care. Sutter Surgical Hospital is a hospital that focuses primarily on surgery, so that means we get to do it really well. We become expert at it. That means that everything that needs to take place before surgery, during surgery, after surgery, and even going home post-surgery, we focus on it and we want the experience to be perfect.
We're very fortunate to have state-of-the-art equipment to allow us to perform complex surgical operations. I'm most proud of, well, not only the physical plant, because it is a beautiful place to work, but also just the great work environment that we have created here through selection of excellence, of excellent staff, excellent equipment, friendly service, personalized service. It's an all-around winner.
We recently started a new project here at Sutter Surgical Hospital to highlight some of our local community artists. Not only does it highlight the quality of their work, but it's nice for our facility. It actually fits our personalized care theme because it looks very personal and homey.
I really like working here at Sutter Surgical Hospital. It's probably the best hospital I have ever worked at in my 37 years of being a physical therapist. It's an atmosphere where every single person that you work with has a caring attitude. They want to do the right thing. They want to be there for the patient and do everything that's necessary so the patient has what they need. You can walk into the CEO's office and talk to her anytime you want. She's always there to listen. And I think it's her attitude that is pervasive in this facility that makes us all feel that we're all on the same page. We all want to do the right thing. And everybody here works as a team. And it's a wonderful atmosphere to work in.
Personal individual attention here is wonderful. The reason I came here was it was suggested by the doctor who was doing the surgery, and to me that's important. In fact, he said he feels so comfortable that he doesn't mind after he does the surgery, he leaves and he knows that his patients are going to be well taken care of because they're all trained.
Communication is critical. Every aspect of the surgery that the patient is going to have needs to be actually perfect, and that's what we strive for.
Doing the right thing seems like a simple phrase, and we all maybe even unconsciously think, well, everybody tries to do the right thing. But it's on our badges. Every orientation we talk about doing the right thing, and they love the idea of working in a culture where that's a priority. If you need surgery and you're looking for the best experience you can have, visit us at Sutter Surgical Hospital, North Valley. We're located at 455 Plumas Boulevard, Yuba City, California. Or visit us on the web, sshmv.org. Oftentimes people don't realize that we're an actual hospital, but the important thing is the personalized care. We really do take a personal interest in every single patient. Each of our rooms are private and have oversized restrooms for convenience. We also have capacity that a guest could spend the night with our patient.
My patients like coming to Sutter Surgical Hospital. They're very happy with their experience. They like the fact that they have private rooms and they get excellent care.
In designing this hospital, our surgeons were involved every step of the way, and it was really important to them that the look and feel of the hospital lived up to the standards we set for the services we offered.
It's what I envisioned and more. I never thought it would be this great. It really has turned out to be an excellent asset for the community.
The environment we've tried to create in our patient rooms is comforting and a place where people want to recover. In fact, we probably have more of a challenge where patients don't want to go home because it's so nice.
I felt like I was in somebody's living room. Personal care of both the patient and the family. And I had my daughter and some friends down there, and they were treated just like family with me. And it was just, they went away thinking, wow, this is a nice place.
While we can't control the reasons that patients are here for services, we can control the experience. That's really important to us. That's our priority, that's personalized care. Our dietary department is made up of chefs and professional cooks, and we have personalized menus, and we serve food that you don't normally see in a hospital setting. Our physicians believe that in order for patients to recover fully, they need to be able to eat and get their strength back, and making sure that patients have a great menu to choose from.
My name is Heather Platter. I'm the executive chef here at Sutter Surgical Hospital. My staff and I are here to make all patients feel like they're at home. We start with fresh ingredients. We feed our patients the finest quality that we can. We do breakfast, lunch, and dinner to the patient's liking. Whatever's in season we run with. So if lobsters are in season, you're going to see them fresh and they're going to be offered to you. We provide a buffet lunch for our staff every day and a salad bar. Our menu switches out every 6 to 8 weeks. That way our second time customers, if you have a total need the other one done, you can come see us. And that way you'll never come back and have the same thing unless you ask for it. So one of the reasons why we cook all of these great foods for our patients is because we want you to be able to heal. Hopefully we help you do that by serving you these comfort foods or things that just make you happy or makes your stay more pleasant so that your healing process can begin here. We do take care of all special diets such as gluten-free, vegan, vegetarian, you name it, we've probably done it. You want us to grind up your steak? We can do it. Sutter Surgical Hospital, they're not your typical hospital. We want everything for the patients to be perfect.
The food here is excellent. My husband calls it a 5-star restaurant. Shrimp one day and wonderful fish the other day, and well, don't plan on this when you get home. The chef came in and wanted to know for sure if it was all right, and just very nice, very, very special.
I appreciate getting to work for an organization that allows us to be creative in our work. We're not limited in what can make the patient happy. Any of our ideas that are for patient satisfaction or how we can make the patient stay better, they let us do it, or they support us, and I have never been anywhere that made me feel like that. So of course I want to work here.
At Sutter Surgical Hospital, our focus is the patient and the experience that our patients have here. And we see the experience including our physicians, it includes our staff, and it includes the comforts of the facility.
Around 01 or 02, we started conceiving the project. It took quite a few years to get it up and running, but once it was up and running, it became clear that we had done the right thing to provide a high-quality surgical hospital. It's important to have access to state-of-the-art equipment and other tools of the trade to allow us to get our job done efficiently, safely, and cost-effectively.
Sometimes physicians worry about being in a smaller community that they don't have the equipment available for them. I've not experienced that here. I'm always able to get the equipment and state-of-the-art things that I need for my patients. With our knee replacement patients, they're generally up and walking the same day of surgery with the physical therapist. That speeds their rehab process. And I have had patients go home 2 days after their knee replacement surgery.
Here at Sutter Surgical, we really realize that not only is the patient a customer, but the physicians are customers too. We really go the extra step to try to make it a pleasant work environment for them to want to bring their patients here, and a pleasant experience for the patients so they want to come back or they want to tell their friends about it.
One of my responsibilities that I really enjoy is working with the physicians. I've been able to bring on new physicians because their experience with us is so positive. We're able to provide efficiencies for them. Some of the things that they might experience with us include really short turnover times, and their days are run efficient so they can accomplish a lot more in a single day than they might otherwise. Our staff are knowledgeable about the procedures that are performed, so the physicians feel very taken care of.
Many patients locally think that they need to travel outside the area to get world-class care. In fact, I met several patients who were from this area when I was doing my training in the Bay Area. And it occurred to me at the time that we could deliver that same level of care to take that training up into local areas that are otherwise underserved. This is a really big deal for patients and their families that are dealing with illness or immobility, something that would keep them from being visited by their family when they're recovering from a surgery. So bringing those services locally here to the Valley has been a really big deal for this community. They have top-notch equipment here. They have very veteran and seasoned nursing staff and ancillary staff here. The anesthesia department is second to none. We can get patients in and out relatively quickly and relatively comfortably, but still do significant work on the inside of the body through small incisions and these advanced techniques that use a lot of computer-assisted navigation and live video x-ray, all of which is available here at the facility.
Well, you definitely have a choice as a patient as to where you want to have surgery, but if you want really top-of-the-line care and specialized personal attention, you want to come here, because you're not just a number, you're a very special name to us, and we're going to personalize all your care to what you need and what kind of surgery you're having done. That's why you want to come to Sutter Surgical Hospital, North Valley.
You have an arrival time that's given to you ahead. You come, obviously, without eating or drinking anything, ready for your surgery. And you will meet your anesthesiologist on the morning of surgery, unless you've requested to speak to them beforehand. And you will be treated, I think, extremely well in a very personal way by the pre-op nursing staff, who will start your IV and get you ready for the surgery. And you meet everyone that will be taking care of you that day. You can have MRI or x-rays done, EKGs, labs. It makes life really easy and efficient for us, actually.
I'm the clinical nurse manager for pre-op and PACU. We do a lot of work getting the patient ready for surgery. We meet with all of them one-on-one to go over their health history and their medications, and just spend a lot of time teaching them about what's going to happen and how to get prepared for surgery. And then we take care of them on the day of surgery, getting them ready to go. Afterward, again, we just spend a lot of time while people are waking up, giving them some care, managing their pain, and teaching them what to do when they go home. Oftentimes patients were going to the ER and for simple infusions and have to wait there, and so we kind of started looking into it to see if we could offer that as a service. It was not available really in this community. So we set up an area in our recovery room that has some nice lounge chairs, recline. We feed the patients. We have Kindles and movie players for them to, have some entertainment while they're sitting here getting their infusion. Nice warm blankets. We just kind of make it a really comfortable experience in a quiet area of the hospital. And we do blood transfusions, we do antibiotic therapy, we do medications for people with long-term illnesses, arthritis and things like that. They like us. They're so happy that we're here, that they want to come back for any of their needs.
It's a small hospital, so we have the ability to give really personal care here. We give classes to the public. They're free classes for pre-op orthopedic joint education classes. I give a pre-op class for spine surgeries, and I also have a pre-op mastectomy class. So that means that people come to the hospital for my classes, and I get to meet them, they get to know me, and then they know that after surgery I'm going to be their physical therapist. So we already have a personal connection, and when I come up to their room they know somebody, and I think that really is helpful for their anxiety level and to help them feel secure here. It's a really nice continuity of care situation that I think you don't find in a lot of other places.